Patrick Hutzel from intensivecarehotline.com with another quick tip for families in intensive care. So today's tip is about a comment that a critical care nurse actually left on my YouTube channel. I just thought it was too true to not share it here. And I'll just read this out to you. One of the subscribers writes, or one of the viewers on my YouTube channel writes, as a retired critical care nurse for over 35 years, I am continually astounded by the family that has a loved one in ICU or neonatal ICU and blindly accepts whatever a doctor says or a team says without doing any research on them, their education, and research on the loved one's illness before giving any consent to care. I have practiced in the United States all my career, and I have seen our medical care plummet from the best to the worst. It has become all about money. The patient is no longer the first and foremost concern. It is about your insurance coverage, your age, your demographics, and your ability to pay. All healthcare is governed by big pharma and insurance companies that control the individual caregiver and especially the doctor. I have always believed that a patient's care is directly dependent on the caregiver's personal sense of morality and ethics. If they have them, they will give you the care they would give their own family. If it is merely a job and they are so burned out that they don't care, the patient is hopeless to get any good quality care. I refuse to put my patient last and ultimately quit nursing because of it. I now believe Singapore and then the NHS gives the best care on the planet right now, but it is ultimately the responsibility of the family to see that their loved one gets the right care. That takes work, and sadly, many do not want to invest the time. Well, it's been what I've been saying here for the last 10 years, confirmed in one comment from a reader. Name is Betty Russo 5410. So thanks, Betty, for sharing your thoughts here. And, certainly why I left the system, because I refused to put the patient last and the organization first, right? The hospital is put first and their financial interests or whatever other agendas that are going on, including medical research, right? So certainly one of the reasons why I left the system, could no longer stand it. I worked in the system for over 20 years in 3 different countries, and I have seen a similar deterioration of what I would consider is moral and ethical standards, that it's all become about money, about insurances, about bed management, about the agendas of hospitals, of intensive care units, sometimes even about agendas of individuals such as, a medical director of an intensive care unit or a nurse manager of an intensive care unit, whatever the case may be. I've certainly seen my fair share of situations where politics override patient care. And it makes you wonder why people go into healthcare in the first place if politics and other agendas are more important than the actual patient that's vulnerable and critically ill, especially in intensive care. So thanks, Betty, for sharing your comment. And, if you are a family in intensive care, you absolutely must do your own research. How can you take for gospel what anyone is telling you, including myself? Even what I'm saying here, you should verify that what I'm saying is accurate, and makes sense. And, my approach is always trust, but verify. You always have to verify what people are telling you. And I can't believe, how many families in intensive care reach out to us and say, oh, last year, my dad was in ICU. We agreed to have life support withdrawn and now my mum or my dad has passed away, and I have second thoughts. Have I done the right thing? Well, from my perspective, you haven't done the right thing, because once you agree to a withdrawal of treatment, there's no return from that, as far as I'm aware. But by not giving in, there's always hope. There's always a chance. Now, case in point. I was talking to a client this morning who has their uncle in ICU probably since around January this year. And the ICU early on was trying to push the niece to consent to withdrawal of treatment, but she refused over and over again. Right? This gentleman is in ICU, ventilated, tracheostomy, had some amputations, had COVID, had sepsis, very ill. And there was a point where he could no longer make his own decisions. And that's when he was probably at his most vulnerable, and the family was at their most vulnerable. And the ICU was pushing the family to agree to withdrawal of treatment. And, I advised them not to agree to it, because, if they don't believe in end of life in such circumstances, then they shouldn't. If they want to wait to see whether the situation is improving, then they should not agree to a withdrawal of treatment. Now, lo and behold, 2 months later, this gentleman is now being mobilized in ICU, sitting up, and he's responsive, and he's now coming slowly to a point where he can probably make his own decision. Now, why would anyone override the patient's own capacity, right? Well, there are situations where someone needs to override a patient's capacity if they are, brain injured and their brain isn't functioning. But, now this gentleman is coming out of the critical illness and the brain starts working again. And now ask the patient, what about where did we leave patient autonomy behind? When did that happen? Right? So I hope that illustrates what's really currently happening in the current environment. And, for anyone watching this, and has worked in intensive care or ER or ED, whatever, you got to ask yourself, are you still in the right job? Are we still doing the right things for patients and for families? Those questions need to be asked. Now, if you have a loved one in intensive care, go to intensivecarehotline.com, call us on one of the numbers on the top of our website, or simply send us an email to support@intensivecarehotline with your question. Email is at support@intensivecarehotline.com. Now, also have a look at our membership for families in intensive care at intensivecaresupport.org. There, you have access to me and my team 24 hours a day in a membership area and via email, and we answer all questions intensive care related. I also provide one-to-one phone, Zoom, Skype, WhatsApp consulting, and I talk to teams in intensive care directly to get the best outcomes for you. I can also represent you in family meetings with the intensive care team, so you can make informed decisions. You can get a second opinion in real time, and you get better outcomes. Now, if you need a medical record review, please contact us as well. We review medical records in real time for families in intensive care, so you can get a second opinion in real time. And, if you combine that with me talking to doctors and nurses directly, it's like rocket fuel. It'll change the situation rather quickly. If you need a medical record review after intensive care, if you have unanswered questions, if you need closure, or if you are simply suspecting medical negligence, please contact us as well. Thank you so much for watching. Subscribe to my YouTube channel for regular updates for families in intensive care. Give the video a like, give it a thumbs up, share the video with your friends and families, click the like button, click the notification bell, and comment below. What are your thoughts? What are your insights? Do you agree? Do you disagree? We want to hear from you. Thank you so much for watching. This is Patrick Hutzel from intensivecarehotline.com, and I'll talk to you in a few days. Take care.